Dr. Claytor here. Many patients come to see me for consultation for abdominal rejuvenation, and what they're looking for is an abdominoplasty. It's also known as a tummy tuck. One of the greatest challenges that we have with patients who have lost their abdominal domain, either from massive weight gain and then loss, either from surgery or diet and exercise, or from pregnancy, is they undergo something called diastasis recti. So here are the rectus muscles, and they have literally been pulled apart. There is a significant amount of confusion for our patients because they don't quite really understand. They think the muscle's pulled. Not true. The muscle's not pulled. It's the fascia in between. And so what we're trying to do is take this oval shape and create a beautiful sculpted figure of 8 shape. And the way we do that is we make the incision down here. And the first thing that we do is we go down, is we go through the skin and the fat, and we come to a layer called Scarpa's fascia. Scarpa's fascia is a sheet of fascia that exists across the entire abdomen. And its main function is to aid in the lymphatic drainage of the abdominal area. It is very, very thin. It is as thin as a piece of paper, like this. I'm going to have to redo it. You can keep running tape because I'm going to get my piece of paper. All right, you still there?
Yeah.
As you make the incision down here in the bikini line, sometimes patients will have a C-section scar down here, and I can make the incision down below that, so that scar is removed, but the incision is hidden in the bikini. And so as I'm making the incision down deeper and deeper, you go through skin, and then you go through fat, and then you come to Scarpa's fascia, then there's more fat, and then you're down to the rectus fascia, and then you're down to these muscles. And you go deeper than this, you're down into the abdominal cavity. What is Scarpa's fascia? Scarpa's fascia is no thicker than this piece of paper. So when you think about how thick is that layer that is being left behind, that is being used to maintain and preserve the lymphatic drainage down into the groin, it is as thin as a piece of paper. So it is not going to contribute or add to the volume bulk at all. There is a misconception, and we're going to debunk this. There is a misconception that using a drain will give a flatter abdomen. Not true at all. Not true at all. And then you have the encumbrance of the drain, the potential of infection from the drain. You have all kinds of issues that come from the pain from the drain, slowing down your recovery. The big part that we want to motivate is safety, and we want to motivate patients and help them with fast recovery. Having a drain does not help. So when we make the incision down here and then lift all the way up to here, so this entire abdominal tissue is lifted up to here, the amount of tissue that was removed is generally in this area. So all that tissue gets removed, and then this tissue gets pulled down. But while I'm in here looking at this, we repair this, and I do it in 3 layers. The first layer is an individual suture that goes here and pulls these two together, and that is a permanent suture, monofilament, so there's virtually 0 chance that there can be any tiny little interstices. Some people use braided suture. These are great questions that you should ask your plastic surgeon. Do you use a braided suture? Do you use a monofilament? Do you use a permanent? Do you use an absorbable suture? Permanent suture, the first layer are interrupted to bring this together. So this is now, these muscles are now brought together, and that's what gives you this beautiful figure of 8 shape. Then the second layer I run is a running permanent suture that goes the entire length of the abdominal wall. And then the third layer that I put in, that is absorbable. It takes about 4 months, 6 months for it to go away. sometimes patients will come in and they'll feel a little knot way up here. And they'll say, oh my goodness, Dr. Claytor, I can feel this little knot. Because their belly's so thin, they're feeling the knot through the very thin abdominal skin. And I'll say, don't worry, that one's absorbable and it will go away. But that final layer folds over tissue even further so that now those permanent sutures are buried. So the different elements of a drainless abdominoplasty are the incision down here, lifting up, repairing that rectus diastasis to give that beautiful contoured shape. And then now that that skin's been removed, we pull it and advance it down, and we need to bring out the belly button. That's a whole other talk that I will give about the aesthetics of a belly button, to give a tiny, cute little shaped belly button that has a little shadowing and contouring so it's practically invisible rather than a big donut incision, which I'm not a fan of. So you pull that skin down, and then this is where the new incision is, again down in the bikini line. That's where the incision goes when everything's pulled down. The new belly button is created here. This is the second part. This is the second part about how to do a drainless tummy tuck. And that is, as the tissue is being pulled down, sutures are placed between that abdominal skin and the fascia here that effectively close that tissue off so no fluid can accumulate in there because it's been pulled down. On top of that, we have that scarpa's fascia down here, which is acting like a sump pump, a drainage ditch that is pulling that fluid that's left there down into the groin, and then it gets circulated back into the blood supply, and then a patient would pee it out. The third thing that I do that tremendously minimizes the need for a drain and cuts down on edema and inflammation is when I'm doing this dissection and lifting up the skin, I use very little cautery. The majority of the dissection is done with a sharp scalpel. We know where the blood vessels are. When we find them, we see them, and we cauterize them. Zzz, zap. Generating about 2% of the thermal injury to the abdominal wall. If you've ever been cooking and burned yourself at the stove, you get a little blister on your finger. Well, if a surgeon is using that cautery to do the entire dissection, then they are generating that amount of thermal insult and injury to that tissue, and guess what it's going to do? It's going to flood that area with fluid. Then you're going to be stuck in a situation where you need to put in a drain to pull that fluid out. So in fact, those patients are going to be more swollen and have a potentially thicker abdominal wall than if you were to use very little amount of thermal injury while you're doing the dissection. So the big part about the tummy tuck that you can do drainless, which means no drains. If you look online, you see drains. Sometimes people have drains coming out of the pubic region or out of the side. I stopped doing these drains about 15 years ago when a patient that I had put in, my first 5 years in practice, I was using drains. But a patient had their drain coming out the side, and as they walked through a doorway, they caught that drain on the doorknob, and it pulled out. It's okay, everything turned out fine. She did shove it back in, and she got a small local wound infection. It all turned out fine. But the point that I'm getting at is these drains are painful, they're an encumbrance, they slow down patients' mobility so they are not recovering as quickly as they could. So, drainless tummy tuck, faster recovery, absolutely beautiful sculpted results, and you can even tighten up that tissue as you're putting in those progressive tension sutures to flatten that abdominal contour and give you even more beautiful contoured sculpted abdomen. And so really what we're talking about is utilizing all these techniques and moving into not just a tummy tuck, but a sculpted abdomen with this beautiful figure of 8 shape and creating high definition contours of the abdominal muscles and a little shadowing and shading into the upper groin area to create that beautiful contoured shaped result that patients are craving when they're looking for that beautiful abdominoplasty. I hope this has helped debunk any kind of mystery out there or confusion about the difference between a drainless and the old school or previous technique that many surgeons had used, and quite often if you're working with a surgeon who has many years of experience, more likely than not they have encountered challenges, and they have tried to migrate into drainless. I have been teaching the drainless abdominoplasty technique at the Aesthetic Society meeting for over 11 years and taught hundreds upon thousands of other surgeons how to do this technique. It is fantastic. It works. It'll even work for what we call a belt lipectomy, where you're going all the way around. Fantastic technique that delivers sculpted, amazing results, minimal downtime, fast recovery. If you have any questions about it, come on in. We'll show you all kinds of before and after pictures of patients who have had the drainless tummy tuck technique. Hopefully this debunks that theory. Hopefully this debunks that miscommunication and confusion that's out there circulating on the internet. I hope you found this helpful. Thanks so much.